obviously we encourage everybody to contribute where they would like, but I will indicate that.
Yeah.
Mm-hmm. So Andy will join a bit late, right, Robin? But he will join the panel actually.
Yeah, he said he would join at his 9:30, so like 1 hour after it has started. So like once he's done with his lecture, and then he will join right after. So we'll see when he's there, then we can also address question to him. Yeah.
Okay.
Yeah.
But he will be in for the first presentation, the keynote.
It's a recording.
Ah, it's recording. Okay.
Yeah, he said he has another thing that he has to do, so he said
I see.
he recorded already, and then he will join during the discussion.
Okay. But nobody from WHO could attend.
Yes, that's a failed attempt. We could try to contact several already, but maybe it's also because in August a lot of people are on vacation. It was very difficult to get response, and we waited until the last minutes. But okay,
Okay,
it's a pity, but yeah.
it would have been lovely to see Dahmed here,
Mm.
but okay, then I just stop my video and mute myself for a while.
Okay, yes, we'll start in about 19 minutes or so.
Yeah. Okay, see you soon. But I'll
See
be
you.
here in the room, so if you want some, just shout out.
Okay, we will.
See.
Masih ada satu yang S20 speaker belum rename, siapa ya? There is one S20 speaker ID which has not been renamed.
Mungkin Prof. Satrio ya, Pak.
Prof. Satrio?
Iya, tapi belum gabung. Mbak Hanifah mungkin mau cek video.
Pak Yudi, can I test my
Yeah.
video?
Yes, please.
Okay, the first video is UGM profile.
Good morning, ladies and gentlemen. Welcome to our
ini yang
science
welcome
day.
remark, Pak. Bukan UGM profile.
Sorry, ini yang welcome remark. Terdengarkah Pak Yudi?
Shared
Terdengar.
by the Indonesian Academy of
Terdengar.
Sciences.
Baik, kemudian yang UGM.
Tapi gambarnya patah-patah ya Mbak Hanifah tadi. Apa yang lain mungkin patah-patah tidak?
Iya sih, di saya juga agak patah-patah. Coba yang satu lagi, Mbak.
Ini masih patah-patah juga.
Agak ya.
Masih ya kurang smooth ya. Koneksinya atau bukan videonya? Kalau videonya harusnya.
Dari YouTube.
Oh, YouTube-nya ya. Kalau yang punya S20 juga YouTube juga patah-patah juga atau enggak tadi?
Saya coba, Pak.
Bukan YouTube ya yang S20 ya?
Bukan. Ini bisa.
Oh ya, ini bagus.
Indonesia is honored to preside over the G20 2022 presidency.
Okay.
Smooth, ya. Berarti mungkin YouTube-nya ya Pak Hanifah ya? Masih mute Pak Sigit sepertinya.
Kalau yang UGM tadi yang pakai file MP4 saja.
Ada yang MP4? Pak Hanifa?
Coba saya coba
Jangan di
naikkan
YouTube.
dulu
YouTube
kualitas.
Iya.
Ya.
We have Shabana join us. Welcome, Shabana.
Yeah, I'm here.
Thank you for joining. Do you have the virtual background with you?
Yeah, sorry, it doesn't work with my background.
Okay.
On my laptop is very
Yeah. I think it's
That's fine.
better with Allah sentence. Allah. I like.
Mas, nomornya ke spread.
Okay, that's fine. Yeah, Shabana will start in about 15 minutes. We're not just trying a couple of videos, or if anybody wants to, but you sound, I mean, we can hear you clearly, so that's fine.
But Robin Fear doesn't test anymore. Is there any Robin Fear here?
Yes, Robin is here.
Yeah.
Yeah, he already.
Try
Yeah.
first.
Good morning, ladies and gentlemen. Welcome to our Science
Okay.
20
This is a-
Yeah,
forum
it's better.
chaired by
But
the
this is not
Indonesian
the
Academy
profile.
of
This is the
Sciences
welcome remark.
in collaboration with the
Ya, saya kira lebih baik ini.
Oh, ini saya yang mainin.
Asal waktunya. Oh, bisa ini ya di. Ya, ada waktu kan, Mbak?
Ada.
Hello. Yeah, it's good.
Yeah.
Could you try speak, Mr. Robin?
Oh, sudah tadi, Pak.
So you want me to speak? Is that okay?
Oh, okay.
Yeah.
It was okay earlier.
You have been try.
Yeah,
You
sudah
got
tadi.
in
Yeah.
a picture. Oh, that's good.
Just to make sure the audibility. Okay,
Yeah.
so I think everybody's okay.
Yeah, okay.
Oh, Prof. Satrio is already with us also. So, okay, we have Professor Satrio, we have Prof. video, we have Andy's video. Here's Volker. Welcome, Volker. You're still on mute. Still on mute. Can you hear us?
Good morning, everybody. I can hear you, Yuri.
Good morning. Okay.
Hi.
Welcome.
Good morning.
Morning.
Hello, everybody. Hi, Robin.
Hello, Volker.
Hello.
And I see Maria. I saw her yesterday.
You met her yesterday. Okay.
Yeah.
Yes, I'm here just behind the screen.
Okay. So we're just missing our colleague from the ministry. Ada yang bisa konfirmasi ke Pak Anas atau sekretarisnya? Ada yang bisa bantu konfirmasi Pak Anas? Kemarin yang menghubungi ke sekretarisnya siapa ya? Coba saya japri itu ya. Oke. I'm sharing in the chat. That was just a slide from Dr. Anas from the ministry. He said he might want to use this on the panel, Robert. So if Robin, if you can hear me on the chat, there is a slide which has just been sent by our colleague from the ministry. Pak Sigit, ini kita sudah tahu yang akan masuk, sudah ada antrian atau belum? Kan dia tadi belum kelihatan ya.
Siapa?
Bisa lihat ada antrian berapa orang yang mau masuk? Bisa kelihatan? Saya nggak bisa lihat.
Belum ada, Pak. Di
Belum ada,
attendance, iya, hanya panelis. Biasanya kalau udah di start webinar baru pada masuk, Pak.
Oh gitu. Oh, tapi kita nggak bisa tahu sama sekali ya berapa yang akan masuk gitu ya?
Nggak muncul di sini, Pak. Belum kelihatan.
Nggak muncul, Pak. Kalau kita undang ke jurnalis, ke grup-grup sudah, saya kira sudah cukup banyak.
Jadi baru kalau kita start, baru kemudian mereka masuk gitu ya?
Ya biasanya baru kelihatan.
Oke. Siang Bu Pinja. Masih mute Bu Pinja?
Maaf terlambat ya.
Belum.
Jadi lari-lari dari IP.
Saya nggak mau pulang, Bu.
Yeah. So, good morning to Volker, Robin, Shabana, and Maria.
And Johanna is already
Johanna.
Nice to see you.
Okay. Nice to meet you.
Same here.
Yes, and welcome to our webinar.
Thank you so much.
Yes, you're welcome. And then I'm sorry that I was late because we've got the program as well this morning, and that is the face-to-face meeting. So, you know, it's in-person meeting. So I just run and then try to get home as soon as possible, and then just open my laptop now. And I believe that Sigit,
I'm still in office.
He's still in the office. Okay.
Yeah, because it's raining, so it's difficult to get.
Good morning.
Yes.
To my car.
Welcome to our Science 20 forum chaired by the
Ini aman Mbak Anifa.
Academy of
Kalau yang profile yang UGM malah nggak bisa ya Mbak Anifa tadi ya, Shopee ya YouTube ya.
Saya coba lagi.
Ini kita belum buka ya?
Belum.
Oh, oke.
Ini tadi ada sedikit trouble dengan video. Kalau misalnya ini trouble ya. Oh ini nggak apa-apa.
Ibu Rika, sehat Ibu?
Ya, terima kasih. Sehat. Tadi saya ikut juga kok yang pagi.
Oh ya, tapi
Ya.
dengan ini ya, virtual. Karena Mbak April bilang, "Bu, datang dong, soalnya nanti sedikit yang datang." Ya udah, jadi lari-lari ke sana, lari-lari balik lagi.
Bisa kita mulai, Pak?
Ya, Mbak Hanifah tadi videonya sudah aman. Tadi kok cuma sebentar.
Ada patah-patah enggak?
Selamat siang, Prof. Satrio.
Selamat siang, Mas Yudi.
Terima kasih, Prof. Satrio.
Sudah.
Sama-sama.
Kita bisa mulai, Pak.
Ya kalau begitu silakan bisa di start webinarnya ya Pak Sigit, Pak Indahnya, nanti dengan video dimulai.
Okay.
Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada has grown rapidly over the years and positioned itself to become a leading institution in Indonesia and in the region. It was established on March 5th, 1946 as the oldest Faculty of Medicine in Indonesia. It aims to become an innovative and excellent Faculty of Medicine, Public Health and Nursing with international standards and to always serve the nation and humanity with national cultural values based on Pancasila. The mission of the faculty is to improve public March 5th, 1946 as the oldest Faculty of Medicine in Indonesia. It aims to become an innovative and excellent Faculty of Medicine, Public Health and Nursing with international standards and to always serve the nation and humanity with national cultural values based on Pancasila. The mission of the faculty is to improve public health status through education, research, and excellent services based on local wisdom, ethics, professionalism, and evidence-based science integrated in the academic health system. Various study programs in Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada has successfully achieved accreditation, such as TRUP-Ed, Asian University Network Quality Assurance, and Philippine Accrediting Association of Schools, Colleges, and Universities at the international level, and the Indonesian Board of National Accreditation for Higher Education and Indonesian Accreditation Agency for Higher Education and Health at the national level. Supported by lecturers, including professors, supporting staff, departments, research centers or working groups, Universitas Gadjah Mada Academic Hospital, Central Public Hospital, Dr. Suraji Tirtonegoro, and Dr. Sarjito Teaching Hospital, which is currently accredited by Joint Commission International for Academic Medical Center. The faculty offers undergraduate programs, graduate programs, medical specialist programs, and combined degree programs. Every year, over 500 undergraduate students and 600 graduate students are enrolled. The faculty continually develops and improves a flagship program called Continuing Professional Development through guest lectures, seminars, symposia, and workshops. Moreover, the faculty is equipped with IT facilities and information systems that are integrated with the university system, video conference facilities and webinar, a computer-based test room in a convenient academic atmosphere, and a green campus. Supported with comfortable workspaces, museums, sports facilities, and disabled-friendly buildings. Active partnerships and strong collaborations have become inseparable parts of our faculty, without which progress in education, research, and community service would not have been achieved. Our international partnerships create ample opportunities for student and staff exchange, research collaborations, community services, as well as development of international, double degree, and sandwich programs at the undergraduate and graduate level.
As the one of the oldest medical school in Indonesia, we always encourage the quality of interprofessional education, strengthen research collaboration, community services based on local wisdom values, and modern technologies with international standard. Welcome to our Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada.
Indonesia is honored to preside over the G20 2022 presidency with the theme, To Recover Together, Recover Stronger. It hopes to enhance the global collaboration efforts required to face some of the challenges around the world, but especially here in the Asia and Pacific region. Asia and the Pacific is the largest, fastest growing, and most populous region on Earth. Rich with traditions, a colorful history, and abundant with many possible futures. While the region includes the world's most visited city, its second largest economy, and the top 5 countries with the highest IQs, it is also one of the regions under greatest threat from climate change, environmental pollution, loss of biodiversity, gender inequality, and a regression in poverty levels due to the global pandemic. To navigate this uncertainty and complexity and build resilience, we need to envision a wide range of possible futures. But in the end, the preferred future is the one that we need to rally around to build coalitions and inspire action. With knowledge, science, and evidence as the foundation, we need to employ our intelligence, imagination, and emotions to innovate. We must all integrate science into public policy discourse to be futures literate and build a better tomorrow and move away from business as usual. The Indonesian presidency of the G20 is committed to a vision of recover together, recover stronger through the 3 main pillars of promoting productivity, increasing resilience and stability, and ensuring sustainable and inclusive growth. Under the Sherpa track, there are 10 engagement groups including Science 20. The Science 20 pillar takes on how to improve our development support using scientific evidence and innovative solutions together with enhanced public policy. We need strong scientific collaboration to design solutions under a strong and unified G20 framework. Our challenges today, whether the global pandemic or the climate crisis, are all interconnected and require urgent action from a global community. Science is the bridge that will enable us to make crucial links required to find the necessary solutions.
Assalamualaikum warahmatullahi wabarakatuh. Good day to everyone. My name is Yodi Mahendra Datta, Dean of the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. On behalf of the organizers, the S20 Secretariat and Universitas Gadjah Mada and IAP, I am pleased to welcome everyone to the S20 Climate Change and Health webinar. This webinar is part of the Indonesian presidency of the G20 in 2022. In this webinar, we will discuss how to bring science into policy and how to strengthen and integrate climate change adaptations and mitigation solutions and health system resilience. We are pleased to have a group of distinguished speakers and panelists to share their thoughts with us on this important topic of climate change and health. I will introduce them in turn. So without further ado, please let me turn the floor over to Professor Satrio Sumantri Brojonegoro, President of the Indonesian Academy of Sciences and Chair of the S20. Professor Satrio is trained in mechanical engineering and was previously Director General of Higher Education of Indonesia between 1999 and 2007. Professor Satrio, the floor is yours.
Thank you, Mr. Chairman. Honorable speakers and panelists of this webinar, colleagues from Inter-Academy Partnership, fellows of the Indonesian Academy of Sciences, and Rector of University of Gadjah Mada, distinguished colleagues from S20 of G20 countries, our stakeholders, dialogue partners, and collaborative partners. Ladies and gentlemen participating in this forum, a very good morning and afternoon, and a warm welcome to all of you. Thank you for your presence, support, and contribution for this Science 20 webinar as part of the G20 Indonesia Presidency 2022. The theme of this webinar is on climate change and health, to bring science into policy, strengthening and integrating climate change adaptation and mitigation solutions, and health system resilience. It is very much alike to the issues that the world should be tackled. Especially, it has been more than 2 years that we are fighting against the COVID-19 pandemic. The theme also completes the 3 pillars of the G20 Indonesia Presidency 2022. There are global health architecture, digital economy transformation, and energy transition. The first topic emphasizes deliverables at restructuring by emphasizing at the global fundraising, resilience, and harmonized global health standards. As health systems are the main line of defense in protecting population from climate change impacts, it is essential to ensure that health system can continue to deliver essential health functions during extreme events and under climate stress. World Health Organization, WHO, responds to the needs for health system resiliency with an operational framework for building climate resilience health systems. The framework gives guidance for health system and public health programming to increase the capacity to face climate change. According to the latest Intergovernmental Panel on Climate Change, IPCC report, climate change are occurring in every region and globally. It is unmistakable that human influence has formed the atmosphere, ocean, and land. Widespread and rapid changes in the environment have occurred, and coupled to the influence of human health. The environmental footprint and the blurring between the natural and the built environments give the risk of emerging infectious disease such as COVID-19, in large part because of increasingly interact among humans, livestock, and wildlife in the new and unexpected ways, bringing new species and their resident infections together with unpredictable results. As temperature rises, the geographic range of some diseases will expand. Warming oceans cause the areas that were once too cold for certain bacteria to flourish, to be more susceptible to outbreaks of disease such as cholera. The World Bank has estimated that the global warming of 2 to 3 degrees Celsius could increase the number of people at malaria risk by up to 5% and diarrhea by up to 10%. Without concerted actions, climate change could mean more than 100 million additional people living in poverty by 2030. Moreover, rising temperatures and air pollution is already causes approximately 8 million deaths a year, and diminishing supplies of clean water and rising food insecurity could create problems to both health and development. Those complications enable governments to maintain the Paris Climate Agreement and meet Sustainable Development Goals, SDGs. Therefore, the collaborative efforts and action that governments made through international community should be beneficial in achieving stronger recovery and ensuring resilience for all. However, the efforts need an ambitious political will and strong policymaking supported by science-based policy, which include the necessities to accelerate research and development. Recommendation and action should be proposed to aim at promoting a more shared, inclusive, and resilient growth for all. G20 needs to strengthen cooperation to overcome climate change, to enhance health system resilience, and to fortify science and technology contribution for the quality of life improvement. G20 should foster countries' ability to use science and technology in creating evidence to make decisions in uncertainty conditions, where quantitative judgment alone will not sufficiently guide national policymaking. As part of G20's partnering event, this international webinar partakes a main concern in providing a comprehensive understanding about climate change and health under the collaboration among Science 20, Indonesian Academy of Sciences, Inter-Academy Partnership, and University of Gadjah Mada. My sincere thankful to our collaborating partners for their support and dedicated work. My deep appreciation to the rich experience of speakers that should enable to provide powerful insight in adopting environmental friendly development approach to the current state of climate change and health. Lastly, my thankful to the webinar organizing committee for their dedicated work process to make this webinar possible. Thank you once again for your attendance and contribution. I hope we have a productive and fruitful discussion to enrich the recommendations for the benefit of G20 commitment and for the betterment of the future of our only one planet. Thank you very much.
Thank you, Professor Satrio, for sharing and highlighting the importance of climate change and health from S20 perspective. Now we will turn to Professor Olva Emilia. She's the rector of Universitas Gadjah Mada. Professor Olva is an expert in medical education and also a gynecologist. She was previously the Dean of the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. Unfortunately, she could not be with us live today as she's on duty travel, but she has kindly prepared a video recording of her opening remarks. Can we have her video remarks, please?
Good morning, ladies and gentlemen. Welcome to our Science 20 Forum, chaired by the Indonesian Academy of Sciences in collaboration with the Inter-Academy Partnership and Universitas Gadjah Mada. It is truly an honor for Universitas Gadjah Mada to take part in Climate Change on Health International webinar with the theme Bring Science into Policy, Strengthening Health System Resilience for Climate Change. We sincerely thank all of our international and national experts in this forum who are willing to provide the current state and evidence on health system resilience for climate change. Ladies and gentlemen, the World Health Organization estimates that annually there are 13 million deaths worldwide due to the effect of climate change. The increase in Earth's temperature, extreme weather, and decreased air quality have in fact become catalysts for various diseases, such as infectious diseases, respiratory, heart, and nervous disorder. In addition, this situation can also affect mental health, pregnancy status, birth, and nutrition. The health system in Indonesia cannot be separated from the potential health risks due to the impact of climate change. Responding to these challenges, the country needs a systematic effort in developing solutions to climate change issues, especially in the health sector. Today, I'm pleased to invite all of you to join this conference to discuss about strengthening health system resilience for climate change. Hopefully, this forum is expected to be a manifestation of government and community collaboration for the climate change effect in the future. Please enjoy the S20 Indonesia 2022 Forum. Thank you.
Yodi, you're still on mute.
Thank you, Professor Olva, for your opening remarks. Now we turn to our keynote speaker, Professor Andy Haynes. He is the Professor of Environmental Change and Public Health, Center on Climate Change and Planetary Health at the London School of Hygiene and Tropical Medicine. Professor Haynes currently co-chairs the Inter-Academy Partnership, consisting of 140 science academies worldwide, working group on climate change and health, and also co-chairs the Lancet Pathfinder Initiative on health in the zero carbon economy. Professor Haynes will be joining us later as he still have other obligations at the moment, but he has kindly prepared a video recording of his keynote presentation. So we will start with his video.
Thank you very much for inviting me to give an overview of the recent Inter-Academy Partnership Global Synthesis Report on climate change and health, with a strong focus on solutions. This was the result of quite a long process of regional assessments, which started in 2019 with the European ESAC report, 3 regional reports for Africa, Asia, and the Americas, which provided an overview of the current situation in these different regions, providing science-based recommendations tailored to the requirements of those regions. And then the Global Synthesis report, which highlighted the regional similarities and differences, providing advice and support for decision makers for implementation at different levels, global, regional, and national levels, taking into account local circumstances and the needs of different strategic perspectives. So it was very much a collaborative effort involving about 80 scientists from many countries around the world. So first of all, let me start with an overall framework linking our climate change to human health. And you can see at the top here, increasing levels of carbon dioxide and short-lived climate pollutants like methane, leading to climate change, and through a range of demographic, socioeconomic, environmental, and other factors. These shape the magnitude and the pattern of risks, resulting in increased exposures across a range of different exposure pathways summarized here, right the way from the very direct heat, stress, extreme weather events, through to the less direct air quality, water quality and quantity, food supply and safety, vector-borne disease distribution and ecology, and of course social factors like increasing poverty, population displacement, and perhaps conflict as well. And I'll touch on a number of these categories, but I won't have time to be comprehensive. First of all, the direct effects of heat. It's well known, of course, that heat exposure increases death rates, particularly amongst the elderly population. But also as temperatures increase, this reduces the capacity to conduct physical labour. And a paper a few years ago in Lancet Planetary Health estimated that about 1 billion people would be exposed to such extreme heat. This would prevent even moderate physical labour in the hottest month after the global temperature increased above about 2.5 degrees, something of that order, above pre-industrial levels. And of course, even before then, many hundreds of millions of people were seriously affected. And indeed, we're already seeing declines in labour productivity as a result of climate change. We also know increasingly that we can ascribe human health impacts to climate change rather than natural climate variability. And this is a very important recent paper in Nature Climate Change last year, which estimated that more than 1/3 of total heat-related deaths over recent decades could be attributed to human-induced climate change. And it used data from over 700 sites in 43 countries. You can see that there are large areas that are grey. These are areas for which there is really no adequate data. So the estimates are probably underestimates, and we, of course, urgently need to fill in these data gaps to get better estimates. But already you can see that climate change is having an impact on heat-related deaths around the world. We also know that climate change increases the future risk of mosquito-borne diseases. This is just a recent paper in Lancet Planetary Health, showing that because of a combination of rising temperatures and population growth, over 4.5 billion people could be exposed if temperatures rise over 3 degrees centigrade, compared with 2.4 if temperature increases could be held to about 1 degree. And remember, we're already at 1.2 degrees, so clearly that's a theoretical projection. And you can see the dramatic differences between the two, between essentially a worst case scenario and a best case scenario. We also know that there'll be widespread pervasive impacts on food production. We know that as CO2 levels increase in the atmosphere, this can result in reduced micronutrient levels, zinc and iron, for example, so increasing micronutrient deficiency around the world, but also an impact on food production, as shown in this slide. And you can see in many parts of the world, food production, crop yields declining by mid-century, may increase in some temperate regions, but of course we don't know whether populations in low-income countries could afford to buy food on an increasingly competitive global market. And we've seen in the case of Ukraine how these disruptions are already forcing more people into hunger. Not just the physical health effects, of course, it's also mental health effects, increases in common mental disorders after floods, droughts, wildfires, new concepts like solastalgia, which is the distress and the grief caused by environmental change, witnessed by a number of communities, for example, communities in the Arctic or Australian farmers who've seen their livelihoods disappear as a result of drought. And then we're increasingly recognizing that young people around the world are suffering from climate anxiety because they have very real concerns about an uncertain and potentially hazardous future. So that's certainly understandable. So many mental health consequences of climate change and concerns about climate change. So how can we respond? Well, there are two broad types of responses, of course. Adaptation, which is action to manage the risks of climate change impacts, reduce the risks to human health, better water conservation, for example, more resilient crops, better disaster management, business continuity, better flood protection, infrastructure upgrades, heat wave early warning systems, disease early warning systems, and mitigation, cutting emissions that cause climate change. And these can benefit human health, not just by reducing the risk of dangerous climate change, but also reducing exposures to, say, air pollution or unhealthy diets or physical inactivity from sedentary lifestyles. These mitigation strategies, well-designed strategies in energy, transport, food and agriculture sectors can all improve health in the near term, as well as reducing greenhouse gas emissions. There's much, of course, that can be done in the context of cities. Accessible and efficient public transport and active travel can improve physical activity, reduce air pollution. Universal access to clean, low-carbon energy, obviously reduce energy poverty, but also reduce air pollution. Safe access to green spaces, We're recognizing that green spaces are important for physical and for mental health, and ecosystem strategies for resilience, reducing flood susceptibility to floods, for example. And then obviously housing improvements, water and sanitation, big benefits to human health, but also can help to improve resilience to climate change. So these are the steps we need to take in order to keep to 1.5 degrees. And sadly, we're not taking those steps. We need to stop building new coal power plants. We need to phase out fossil fuel cars. We need to develop a vision for aviation and shipping, move rapidly towards low carbon industrial installations, zero deforestation, and so on. And as we know, this target of 1.5 degrees is rapidly slipping out of reach, sadly. But we can still keep to well under 2 degrees if we implement cuts in greenhouse gas emissions, which of course is such a key objective of the Paris Agreement. And in doing so, we can benefit human health in the near term, as I mentioned earlier. For example, if we phase out fossil fuels, millions of deaths, this particular estimate is about 3.6 million deaths, premature deaths annually, from reduced ambient air pollution, from phasing out fossil fuel combustion, fossil fuel burning, replacing that with clean, renewable energy. And you can see where those potential health benefits could be achieved in China, in India, much of Europe, North America, less so in other parts of the world because less fossil fuels are burnt. But of course, if fossil fuels are increasingly burnt, then the potential impact of air pollution becomes greater. The benefits could be very large. A recent study in Lancet Planetary Health showed that using data from just 9 countries, if they were to follow ambitious nationally determined contributions in the Paris Agreement that put health at the center of new climate policies, there could be a reduction in air pollution deaths by over 1.6 million annual deaths by 2040, diet-related risk factors by over 6 million, and physical inactivity by about 2 million, something of that order. So big potential benefits, and that's of course not a global assessment. We're also realizing that the healthcare system itself is a major source of greenhouse gases, about 4 to 5% of the total global total. If it was a country, the healthcare system globally would be equivalent to about the 5th largest emitter on the planet. Much of that is scope 3 emissions. They're indirect. They're because of supply chains, pharmaceuticals, medical equipment, and so much are very energy intensive. So we need to move towards climate resilient and environmentally sustainable healthcare facilities. And over 50 countries have committed to building health systems which are able not just to withstand the impacts of climate change, but also low carbon and sustainable. And 14 countries have set a deadline of 2050 or earlier to reach net zero. So there's a lot of activity going on in the healthcare system. In our IOP Global Project, we published a paper last year in PLOS Medicine summarizing many of the evidence-informed policies that could be undertaken and implemented for tackling adverse climate change effects on health. And this gives a broad summary of many of the conclusions that came out of our report. So following the launch of the report a couple of months ago, we see a number of continuing roles for academies in engagement. Nationally, of course, by engaging with policymakers, national policymakers, explaining the relevance to local context of evidence available from elsewhere. Regionally, taking into account different geographical, socioeconomic and cultural factors. And globally, of course, ensuring that the voice of those, particularly from the lower middle income countries, from vulnerable groups who are not always heard, are given much greater priority, and emphasizing the importance of health equity and climate justice in addressing the climate emergency that poses such severe threats to our health, but also provides opportunity to benefit both health and the climate. Thank you very much.
Thank you, Professor Haynes, for setting the stage for our panel discussions. So we are now ready for the panel, but before we go to the panel, I just would like to mention that for those of you who have questions that you would like to raise later to the panelists, including Professor Haynes, you can write your questions in the Q&A function. So if you look at the lower button in the menu, there's a Q&A function. So please type in your questions in the Q&A so that they can be addressed later during the discussions. Okay? So now we turn to our panel discussions, which will be moderated by Dr. Robin Fierce, the Director of Bioscience Program of ESSEC, He has over 29 years of experience in the pharmaceutical industry in the UK in R&D. And while in industry, he served on committees advising UK and EU trade associations, UK government, research councils, and so on. And he was honorary senior fellow at the School of Public Policy, University College London. Dr. Robin, the floor is yours.
Thank you very much, Jody. And thank you to the organisers for inviting me today. Let me just make a couple of brief comments before I introduce the panelists and they make their own contributions. Last July, the UN General Assembly adopted a historic resolution declaring that access to a clean, healthy and sustainable environment is a universal human right. Now, global political action is needed to deliver on this fundamental human right, and action must include attention to global health architecture, a core pillar of the current G20 Indonesian presidency priorities, as we heard from the president of the Indonesian Academy a little while ago. We've also heard in this workshop so far how scientific evidence is vitally important in informing policy development and implementation, and with particular reference to the strengthening of health system resilience in the face of climate change. One major input to the design of the workshop today has been the major global project organised by IAP and introduced by Andy Haynes, and we hope that Andy will be able to join us during question time again. This IAP project brought together scientists from around the world, as you heard, including very active representation from the Asia Pacific region. And several of our panelists today have participated in this IAP project to help to assess the evidence for climate change impacts on health and to focus on mitigation and adaptation solutions as a priority. The purpose of our panel discussion today is to explore further some of these key issues relating to climate change and health and support interaction with you in the audience. And we welcome your questions for discussion, as Yudi has already mentioned. We're very fortunate today to have distinguished panelists with diverse and worldwide experience. They will each have 5 minutes to describe their own perspective, and they've been invited to comment on any point relevant to climate change and health. That is on the issues that we've already heard in our webinar or described elsewhere in the IAP project reports and this year's S20 discussions, or other recent work such as IPCC, which has been mentioned earlier, WHO and the Lancet Countdown. I'll just mention briefly the order in which our panelists will speak and then give slightly more introduction when each one comes to the floor. We'll start with Maria Nilsson, who will be discussing her own work on climate change and health from her leadership of the Lancet Countdown on climate change and health and her academic position at Umeå University in Sweden. She will be followed by Sofia Mubarika, who is chair. I'm not sure if perhaps the slides will come when. All right, so let me just mention briefly, and I'll introduce them subsequently. But our 4 panelists are Maria Nilsson, Sofia Mubarika, Anas Ma'ruf, and I hope I pronounced your name correctly, and then Shabana Khan. And I'll say a little bit more about them as they each take the floor. Following their 5-minute presentations, we'll open the discussion by inviting panelists and other speakers today to comment on any points emerging from the other speakers that they want to discuss. And that'll be followed by broader discussion based on questions from you in the audience. So please give us your questions on what you've already heard and from what the panelists will be presenting. So, but without further delay, Maria, the floor is yours. You have 5 minutes. Thank you.
Thank you so much. Thank you so much for inviting me here today, and also interesting to listen to Andy giving his overview. And with the theme of today of climate change and health, bringing science into policy, I will speak about the Lancet Countdown process, striving to do just that. The 2015 Lancet Commission concluded that anthropogenic climate change threatens to undermine the past 50 years of gains in public health. And it also concluded that tackling climate change could actually be the greatest global health opportunity of the 21st century. Each year since the Commission report was published, we started in 2016, the Lancet has published a Lancet Countdown annual global report, and it tracks the world as it hopefully moves from climate change as a threat to human health to the response to climate change as an opportunity for human health. The next global report will be launched soon on October 25th. The collaboration draws on expertise from around 100 collaborating academic and UN institutions from around the world. It brings together close to 100 authors, and they are climate scientists and geographers, mathematicians and physicists, transport and energy experts, development experts, engineers, health professionals, economists, social and political scientists. So we have a very broad expertise in climate change and health research. The Lancet Countdown has 3 work streams. It's research and monitoring, communications and outreach, and policy engagement. There are 5 working groups representing 1 research theme each. And the number 1 is the health impacts of climate change. The second working group they focus on the response to the health impacts of climate change in the form of health adaptation and also resilience. Number 3 on mitigation actions and health co-benefits. And the working groups 4 and 5 deals with the economic and political context. The 2021 report tracked 44 indicators, and due to the limited time today, I will only mention results from a couple of indicators we follow. The first one is important, it's on heat and health. And in a world that is increasingly warming due to climate change, this indicator measures the vulnerability to heat of populations around the world. Vulnerability to the extremes of heat continues to increase in every region of the world, led by populations in Europe, with the Western Pacific region, Southeast Asian region, and the African region, all seeing an increase of more than 10% since 1990. People over 65 years of age, particularly those with chronic medical conditions, such as diabetes and heart, lung, and kidney disease, they are among the most vulnerable to the health effects of heat waves. We track global heat-related mortality in populations older than 65 years, and exposures to extremes of heat results in a range of health consequences, including heat stress and heat stroke, worsening heart disease, and acute kidney injury, and leads to an increase in all-cause mortality. From 2008 to 2018, premature mortality attributed to heat exposure in people older than 65 years increased by 53.7%, and we see a continuously upward trend. In 2018, WHO's Euro region faced a record of 110,900 estimated premature deaths, 44% higher than in 2000. And relating to the theme of the webinar today, we also have an indicator that follows mitigation in the healthcare sector. Healthcare is among the most important sectors in managing the effects of climate change and simultaneously has an important role in reducing its own carbon emissions. Our indicator measures healthcare emissions that come directly from the sector, but also indirectly through purchased goods and services. The healthcare sector was responsible for approximately 4.6% of global greenhouse gas emissions in 2017. And we see substantial variations in per capita emissions and healthcare access and quality. The Lancet count on expanding its network by establishing regional centers in key locations around the world, including China, Europe, South America, Australia, Africa, and the SIDS, the Small Island Developing States. The centers focus on regional publications, write policy briefs, and work with policy engagement activities. Europe and Australia publish reports on the same day as the global one, on October 25th, and the China and South America reports are published shortly thereafter. And if you want to follow the work on the web, you can follow the work on the website, lancetcountdown.org. And of course, read all the publications. Thank you.
Thank you very much, Maria. And I'm sure we'll return to some of those key points in our subsequent discussion. Let me now turn to our second speaker to invite Sophia Mugarica to present. Her details are on the screen now. Just briefly to emphasize, she was chair or is chair of Task Force 1 of the S20 group, professor at the Faculty of Medicine in the University of Gadjah Mada, which you heard about in our introduction, and indeed a member of the IAP Asia Working Group, so a strong contributor to our IAP project. Sophia, your floor is yours. You have 5 minutes.
Okay, thank you very much, Robin. Good morning, everyone, or good afternoon, everyone. I would like to share about Indonesian experience, the impact of climate change on stunting. In recent years, Indonesia has experienced rapid increase in severe climate-related disasters, and this impacted unevenly in the population. The poor and the vulnerable population included children under 2 and under 5 that are about 8% and 6% in total population, and also pregnant women and women in reproductive age. As Indonesia, an archipelago that consists of more than 17,000 islands, one of the longest coasts, and is the most vulnerable country affected of climate change. The effect of climate change could be different between regions. In east regions of Indonesia, mostly exposed with longer monsoon, drought. Meanwhile, in the west is more rainfall, floods, and landslides. And one prominent effect of climate change is stunting. And this is not only because of damage on food production, as mentioned by Professor Hein before, but this is because of the socio-economic and behavior changes. Indonesia is one among 5 highest prevalence of stunting in the world. And the highest is located at the east part of Indonesia, East Nusa Tenggara, West Nusa Tenggara, and some of the west part of Indonesia, Southeast Sulawesi, Aceh, and also West Kalimantan. And in the last 10 years, the prevalence of stunting falls between 36 to 27, so very high. And responding to this problem and to achieve the SDGs in 2030, Indonesian government has a strong commitment to reduce the stunting in prevalence by 14% in 2024. As member of the United Nations Climate Change Conference in Glasgow, COP26, on health program, Indonesian government is committed to develop climate responsive health system. And this health-related climate change disaster is under the National Disaster Management Agency, and this is coordinated by 15 ministries. So there are many ministers involved. And especially for stunting, under President Act 2018, the government ran a national prize program named Run Pasti, aimed to decrease the prevalence of stunting from 24.1 in 2020 to 14%. So about 3.2% per year. So it's quite very hard. To conduct the activity, collaboration pentahelix between government, national and local government, institutions, business, community, and also social media work together. The program has been very detailed in the activities, targets, and also indicators, and health adaptation is at the operational level. The interventions are specific and sensitive to target children under 2 and 5, also premarital groups, pregnant and productive age, also intervention at the downstream to prevent stunting through awareness program for pre-marriage women at the individual and family level. Adaptation through awareness program at institutional, continuous community education at primary health care through public health adaptation strategy are being conducted. Best practices from Gadjah Mada University as an educational institution, we have very strategic role to contribute on the effort to improve awareness and capacity building to health professionals. In collaboration with WHO CIARO and West Pacific, Gadjah Mada University have been involved on the development of climate change and health modules for health professionals. These modules have been introduced to undergraduate and postgraduate program and has been embedded in the curriculum. And continuous professional education on the continuous medical education through courses and seminars for health professionals from all over the country, and also sharing the climate change module through Indonesian International Master Program at Gadjah Mada in collaboration with WHO, included students from Southeast Asia countries are conducted. And we thank you very much that UGM have a long-standing collaboration with Umayya University. Thank you, Maria, for the continuous support with Dr. Lutfan and Dr. Yodi and the group for introducing the research on climate change and health, adaptation and mitigation policy, to compare between countries, to know the gap, and then how to fill the gaps. One of the activity is related to the development of telemedicine at the healthcare, aims to develop decarbonized healthcare. This program has been adopted as policy at Gunung Kidul district. This is one of the districts at the Yogyakarta province. And additionally, an early warning system for dengue outbreak has been introduced and implemented as an adaptation strategy. Combination of IT with meteorological data has been tested and then validated, and now has been used to support surveillance response in the city of Yogyakarta. And as part of S20 global movement, we should continue to work hand in hand between high-income country and low-middle-income country to fill the gap in research collaboration. And especially in the era of precision medicine and precision healthcare, we need to have a strong leadership, need to learn how to organize big data, how to convergent action under multi-ministries, how to conduct global movement and awareness, and research collaboration to reduce carbon emission, research on food security, and also adaptation for benefit will be strengthened our resilience healthcare system toward the impact of climate change. Thank you very much.
Thank you very much, particularly for your emphasis on the importance of linking assessment and activity at the local, national, regional, and global levels, and also in terms of your emphasis on the problem of stunting, that reminds us that actually we're facing intersecting crises of climate change, COVID, and also the Ukrainian war on effects on food exports, with implications for food insecurity worldwide. And I'm sure we'll come back to intersecting health crises again during our discussion. We now move on to our third speaker, and I very much hope I can pronounce your name something like it should be, Anas Mara, who is Director of Environmental Health at the Ministry of Health, Director since earlier this year, and has a long-standing interest in public health throughout his career. The floor is yours, sir.
Thank you, moderator, Dr. Europeans. Can you hear me? Okay. Good afternoon, distinguished my colleagues from Faculty of Medicine, Gadjah Mada University, Pak Jody and team, also distinguished speakers, panelists, also participants. I'm very happy to join in this webinar, international webinar, I think, regarding to discuss about the impact of the climate change. I will share 2 slides for this opportunity. Okay. I think like speakers before that, climate change has impacted human population in many areas, including agriculture, production, food security, water management, and also public health. However, I think we know that have a great impact is on health sectors. Climate change has become a huge challenge for the planet, considering solution require involvement of citizens. And as of now, many solutions have been identified to address it, also improving our lives and protecting environment, and at the same time potentially deliver economic benefits. Climate change has also been determined as the single biggest health threat facing humanity throughout, like air pollution. You know that some of diseases caused by air pollution, like respiratory infection. Also, climate change cause some of diseases, both communicable diseases and also non-communicable diseases. You know, like cancer and also cardiovascular diseases can cause by the insecurity food, and also other causes. Number 3, climate change has also been determined as the extreme weather events and forced displacement, food insecurity, and also pressure on mental health. Same with the before speakers mentioned. Every year, the environmental factors take the life of around 13 million people around the world. And science has evidence that climate change impacts health both directly and indirectly, which is strongly mediated by environmental, social, and resiliency determinants. In order to climate change, the government of the Indonesia committed to be part of the Conference of Parties 26 Health Program Initiative in 2021 in France. Output of this commitment is set into 3 broad categories for action. First, climate resilient health system. Continue a climate change and health vulnerability and adaptation assessment up to 2023, considering so far it is effective as main source to update the health component of the National Adaptation Plan based on new evidence arising from climate change and health vulnerability assessments. We will continue to carry out vulnerability and adaptation assessment to update the existing Indonesia Health National Adaptation Plan or HNAP 20 to 30 in tandem with the time frame of renewal of our National Adaptation Plan. The second thing, sustainable low carbon on health system. Develop a sustainable and how to making low carbon healthcare system that contribute to meeting the Paris Agreement's emission targeted through the commitment to carry out a baseline assessment initiative of greenhouse gas emission of our healthcare facilities by end to 2022 through regulation in place, guideline in place, apply approved tools, capacity building, and etc. I think we know that the hospital and health facilities cause the carbonize of the planet. Another thing, we publish on an action plan that sets out how we will develop a sustainable low carbon health system through assessment, collaboration, define action, define target of health, co-benefit, and of climate change mitigation sectors by 2023. And we will to arise net zero health sector emission by 2030. And the third, we also will facilitate and given data of updated Indonesian Health National Adaptation Plan 2020 to 2030 to third party who has access for the climate change multilateral funding mechanism. Example, initiative in 2022, we make collaboration with UNICEF, also WHO, to make some of activities regarding to the positioning of the some of the logam berat like timbal, lead, and also mercury. Also, we conduct the how to has resiliency regarding the disasters. In order to provide a comprehensive health response to climate change, health decision makers need to consider the full range of functions that need to be strengthened to increase climate resilience through health sectors building blocks. The operational framework elaborates on 10 components that together provide a comprehensive approach to integrating climate resilience into existing health system. The 10 of the components are leadership and governance, health workforce, vulnerability capacity and adaptation assessment, integrated risk monitoring and early warning, health and climate research, climate resilience and sustainable technologies and infrastructure, management of environmental determinant of health, climate-informed health programs, emergency preparedness and management, and also, last but not least, climate and health financing. Thank you very much.
Thank you very much, Director. In addition to the Indonesian government initiatives you've just described to us, I think it's been very clear during the past few months, but the Indonesian leadership this year of G20 and S20 has been a great opportunity to emphasize the global nature of climate change problems and the possibility for implementation and integration of solutions at the national, regional and global levels. And again, I'm sure we'll come back to that in discussion, which just reminds me to remind all of you that we greatly welcome your questions. We'll be moving into the general discussion in a few minutes after the final speaker, so please have your questions ready. Our final speaker is Shabana Khan, who is Director of Indian Research Academy, also a member of the IAP Asia Working Group on Climate Change and Health, and an alumna of the Global Young Academy, among many other activities. So Shabana, the floor is yours.
Yeah, thank you so much, Professor Robin. And I really want to thank all the organizers, speakers, and all the participants here, because I think it's a very important platform to discuss a very important issue of climate and health. So today I'm going to talk about importance of building local resilience. Resilience is a very well-known term, and in fact, it is applied in various projects ranging from healthcare, infrastructure, communication, or even community resilience. Often it is frequently talked about, not just in literature, but also in policies from local to global level, including SFDRR, SDGs, or the Paris Agreement even. So, but one of the purpose of research is also to highlight the gaps and limitations in the existing practices. But I'm not going to present the detailed literature review, but definitely going to point out some of the examples that all of us can relate to and that require our attention. So we have, as we all know, the COVID is still not over, and many parts of the world are still experiencing some sort of variants and their impacts. And it is not to assume, it's not wrong to assume that most of us here are either partially or fully vaccinated, right? So which is the good part of the story. But also let's look at, most of us have either heard or we know someone who died despite having vaccination. Well, I'm not against vaccination, but I want to draw your attention to some other aspect, which is equally important. So let's look at who are the people who died. So if we look into their scenario, it is published in literature and news also. So if you look into that scenario, these people shared the similar profile of the people who died before vaccination due to COVID. So they are the elderly people or people already having some previous sickness, either physical, mental, emotional. Besides, some asymptomatic people also died. Mostly we classify these people as the vulnerable group. So vulnerability is very important when we talk about any disaster, and not just disaster, but also in terms of resilience as well. So the number of people who died despite vaccination was definitely far too less, a few thousand compared to millions of people who got vaccinated. But that's what when disaster happens, that only few hundred people die in the background of millions of people who survive under the similar conditions. So the point here I want to make is, many of the resilience solutions that are developed, they are basically developed with a novel intention to address the vulnerability. But in application, because of their generic and overarching nature, they fail to deliver the main outcome, because they are meant to address the vulnerability. But because vulnerability is very complex, and many of the previous speakers have already discussed it, as we tend to address it in general, we don't achieve the same outcome as we intend to do so. So now if we see the recent literature and policies, we are talking about universal vaccination with a particular focus on the poorest people. It is again need further inquiry on behalf of all of us because of the two reasons. First, not all the poor people are vulnerable. So there are many poor people who are young, adult, and they are fairly less vulnerable compared to those people who are already having serious medical or health issues. Second, vaccination definitely builds immunity, but it doesn't provide immunity to many other diseases. In India, we have seen recently many deaths happen due to dengue in the slum areas. So we need to also get present to, in the vulnerable location, what are the different kind of vulnerabilities that exist, and we try to address them. Because vulnerability is not absolute, it is always relative to the hazard, and also it is often it is the compounding of various characteristics and factors that makes the vulnerability more complex and more severe as well. Many of the cases during COVID response, we also noted that solutions, because they were generalized, not just become irrelevant in certain cases, but also enhance the local vulnerability. For example, social distancing, that did not apply in case of slums where thousands of people were living in a very compact area. But and the same solution in case of the young adult who had moved to cities, mega cities, either for education or for their work purpose, the same social distancing had impact in terms of losing jobs and isolation, lack of resources, and many of those people also succumbed and they committed suicide. The 2021 data shows that in India, more than 164,000 people committed suicide, which was 7% increase as compared to the previous year, 2020, which was again had shown some increase from the past years. So COVID has kind of very complex kind of impact on the population. And it's very important that when we are developing or planning any resilience solution, we look into different kinds of vulnerability that exist in our society. So importance of building local resilience also emerged because vulnerability has a spatial expression. So it is very well recorded in the literature that poor people tend to occupy the hazardous location, but that is one sort of set of vulnerability. At the same time, if we look into the developed countries, I did my PhD in New Zealand, so I saw many of the neighborhoods had, some of the neighborhood has 80 to 90% of elderly population living in one area, and that they require different set of health infrastructure. So when we are planning, developing resilient health infrastructure, we do not only look into the strength of those infrastructure or what kind of facilities they have, but also what kind of people we are serving and involving these different kind of vulnerable groups into the planning so that true resilience emerge. And that is what I had to share. I hope I contributed. And thank you so much again.
Thank you, Shabana. And thank you for highlighting the need to consider the complexity of the drivers of risk and of ill health, and to take the complex situation into account when thinking about vulnerability and how to target vulnerable groups. Okay, so our 4 presenters have now completed their task, and thank you very much to you all. The next part, or the first part of our collective discussion, begins by asking the 4 presenters, 4 panelists, whether they want to comment on anything they've heard from any of the other panelists before we move into general discussion. So please, I'm not sure that I can actually see all the 4 panelists at the same time. So I don't know if you raise your hand, I might have a problem seeing you all. But anyway, do any of our 4 expert panelists want to say anything more at this stage, but by way of comment on what we've heard over the last 20 or 30 minutes? Sophia, yeah.
Thank you very much. So the last speakers. So I'm very interested on your statement about resilience vulnerability related to vaccination. And I really agree that indeed this is a very complex And I think we need to have to think about collaboration between high-income country and low-middle-income country, and looking for the variability of genetics, and then looking for the interaction between epigenetic and genetic, because the environment and also the way of life between country is so different. So it might give the variation, the variation. Yes. So this is just my idea that we should maybe later on continue to propose this. This point that it is very important because many factors involved. Thank you.
Shabana, did you want to reply to that?
Yeah, so I totally agree. So we definitely need to do more work further, particularly when we are planning solutions, we have to go further at micro level. So definitely we are planning the global solution, but we need to plan at different levels. The scaling of the solution is very important. Yeah.
Okay, thank you for that. Does any other panelists want to say anything at this stage by way of commenting on what we've heard so far? Yes, Director Anas Moro.
Yes, thank you, Moderator Dr. Robbins. I mentioned to Ibu Sofia Mubarika, very interesting the research about the stunting, because I think stunting is a big problem in Indonesia now. We have achieved to reduce the stunting prevalence in Indonesia, and I think stunting has close between climate change and stunting. So how about the relationship between the stunting and climate change? Because some of the stunting prevalence very low in some areas that has bencana, disasters, and also the climate change that's related to disasters. How about this statement, Ibu Sofia Mubarika? Thank you.
Thank you very much.
I think that's a good point. So, Sophia, did you want to respond?
Yeah. Okay, thank you very much, Dr. Ma'ruf. Yes, we actually previously already discussed with Maria to propose stunting as the result of climate change impact. And we know that climate change gave a lot of effect on landslide, flood, drought, and also maybe typhoon, and also clean water availability is not yet in Indonesia available, and this caused the food. In addition to that, also the social behavior changes of the people, because it's not only the poor, because of food production decrease and food price is increased, food securities become damaged. So this is also because of the behavior changes, because parents are working, both parents are working, and children are just taken care by somebody at home, and they don't know about nutrition. So this is the problem of awareness about nutrition. So this is happened why Indonesia, I think, and also we discussed a lot that why stunting in Indonesia always stay at the high prevalence from more than 10 years. And one of it is we think about this is because of the result of climate change indirectly affecting stunting because of the nutrition and as well as the climate change effect of the children. And what is the next question? I'm sorry. Dr. Ma'ruf, you mentioned about the relationship. Of course, this is very clear because climate change will affect vector-borne disease and also chronic respiratory disease. But also, in addition to that, additional non-communicable disease is also increasing. And it is also very clear that non-communicable disease and climate change already shifting the kind of cancer. Before liver cancer is the highest, but now lung cancer is the highest. And also colon cancer is increasing. So this is because of the environmental damage of the climate change. And is there anything that I haven't answered, Dr. Ma'ruf?
Yes, I agree. I agree with your answer, Ibu Sofia Mbarika, because I think climate change has impact to water and sanitation, right? And water and sanitation is very needed, yeah, very basic to achieve the good food, yeah, for children. I think I agree with your opinion. Thank you.
Can I just comment?
Yeah, Maria.
Yeah, I just want to say that I really think it's important to work with stunting also related to climate change, given that it's more than 150 million children worldwide below age 5, or that is, I mean, it's really a huge problem. And relating it to climate change, we see that high temperatures and altered rainfall patterns are projected to reduce crop yields. And that will also lead to a risk that it decreases the amount of food that is available, but also it may alter some food's nutritional content. So it's really a problem that needs to be highlighted.
Thank you very much. The questions are beginning to come in from our audience. Perhaps I might take the prerogative to ask a question myself, but based on what all of you panelists have covered. And I think you've all mentioned issues relating to particular vulnerability to climate change and health effects, and indeed the complexity of understanding that vulnerability. Perhaps we could spend a little bit more time on thinking about who is most vulnerable, and we've heard about population groups such as the elderly and children. But perhaps more so, how can the solutions for mitigation or probably adaptation be targeted to vulnerable groups? And really, how can vulnerable groups themselves be better involved in the design and the implementation of solutions? I think this is a challenge that affects us all worldwide, but might well be tackled in different ways. So be very interested in your perspectives on what should we do and how should we best do it. Maria, would you like to start us off on that?
Oh yeah, absolutely. Yes, absolutely. As you say, climate change will affect everybody, but some population groups are more vulnerable than others. And it's also very complex because impacts of climate change intersect with other societal changes, for example, population aging and urbanization. And there will also be differing vulnerabilities at different locations, different parts of the world. For example, the Arctic, Africa, and the small islands are regions that are likely to be especially affected by climate change. And Africa is one of the most vulnerable continents to climate variability and change because of the multiple existing stresses and also the low adaptive capacity. So the problem is that those who are already vulnerable may be susceptible to relatively small changes also in climate conditions. Individuals may be vulnerable because of particular sensitivity or because of inadequate operation of health and social systems or other infrastructure. So talking about solutions, it's tremendously important to look at the healthcare infrastructure and strengthen healthcare. That is important everywhere. And the solutions need to be diverse, tailored to the problem, but also locally anchored. So having a strong local insight into the problems and the solutions is really important, developing policies also. So, and during heat waves, for example, the elderly needs to be supported and protected from high temperatures. And also thinking about urban heat island effects, where we have city dwellers that are exposed to high heat stress because of urban heat island, increasing vulnerabilities. And then, of course, we also need to think more about the elderly, but also children and pregnant women may be really vulnerable in this situation, but also those in hospitals, in nursing homes, those who are bedridden need protection. So adaptation, locally anchored for the most vulnerable identified groups. We need to do that.
Thank you very much. Do any of our other panelists want to say anything further on issues for vulnerability, either how to detect vulnerable groups, how to involve them in solutions? We have, yes, Marath, I know you have other business, so yeah.
Yeah, sorry, maybe I will comment about this, and then maybe, sorry, I will join the, meeting important with the parliament. Yeah, regarding to the group of the vulnerability, I think women and children, yeah, they are a very, very group that has high rise regarding the climate change impacts. So I think we must give the water and sanitation facilities to give them to improve the access to resilience regarding the climate change. Yeah, water and sanitation hygiene is very, very important for the relating problem. So I think we must conduct the comprehensive assessment of water resources, also working with local market and the private sector and another private like Pentahelix, yeah, regarding to the services of water and sanitation. Also, we must increasing water storage facilities at the household level. I think this is some of activities can we conducted, yeah, to make a resolution regarding the climate change impact. Thank you very much.
Thank you very much for your contributions throughout today. Professor Volker Merlin, you had your hand up. Did you want to say something at this point?
I do have a question to Zofia Mubarika. I think you mentioned in your presentation that you are establishing an early dengue warning system. And could you elaborate on this and also let us know what are the consequences once you have detected in a certain area of your country that dengue is spreading?
Yeah, thank you very much. What should I? This is Professor Volker. Okay. Yes, this is actually Dr. is the one who's doing this IT mitigation for early warning system for dengue outbreak. And for detailed explanation, I think I will invite Dr. Lutfan to explain about the early warning system for outbreak dengue. Could you, Dr. Lutfan?
Yes. Oh, well, actually, this is part of the collaborations with the Umeå University to improve the awareness about the climate change and health. And one of the activity is also related to the research. And also at that time, actually, there was a PhD student that working on this, which is actually also, he is also here in the attendee list. Aditya, which is actually working on this, and one of the activity is aimed to see the link between the climate change with the dengue cases, which is actually very prominent public health problem in Yogyakarta. And there has been actually publications that have been published that link the effect of climate change and health. And one of the strategy is also to see the possibility to use the climate data to predict the occurrence of the dengue cases. And in this case, then there has been initiative to support the surveillance staff at Yogyakarta regions to use the climate data to predict the occurrence of the dengue. And now has been actually piloted in the district health office in Yogyakarta.
Thank you.
Thank you very much. Okay, so we're broadening the discussion out now to involve more of our audience, and you're all very welcome to participate. I don't know if Andy Haynes has been able to join us yet after his previous meeting. If he is here, and I can't see 120 faces in front of me, but if he is here, then please contribute to our discussion. But let me start with a question from the audience. And again, I don't know if you could all see the questions that come up, but it's, and again, forgive me if I garble your name. It's from Agus Ardiancia, I hope, who asked a question about different awareness and action at the national and local levels in health by health policymakers, perhaps particularly from the example of Indonesia that we heard about. And our questioner suggests that there are indeed good, clear examples of mitigation and adaptation to climate change at the national level in the health system, but perhaps less activity at the subnational local level, and perhaps no strategic framework for bringing together those local actions, for example, in health facilities and so on. I guess the question, is this distinction correct in your eyes, panelists, that is initiatives for mitigation and adaptation at the local level have yet to be brought into a strategic framework, perhaps aren't being fully monitored by national policymakers, and how could we do better? Thank you. Sophia.
Yeah, thank you very much. I try to get the answer. And I have a paper from Sustainability in 2022 from, I think, from Oktari. She is a researcher from Aceh. So she published about the Indonesian climate-related disaster and health adaptation policy in the build up to COP26 and beyond. She's doing, they are doing the research on examining policy papers pertaining to the health sector's adaptation to climate-related disasters. And they found out that there are several gaps and challenges that include climate-related disaster, and then about the interconnected nature of climate change impact and health, and that need a set of interlinked stakeholders and policy. Third, lack of shared framework, and then also lack of a policy that focus on cross-boundary information, and lack of coordination across related institutions, and most policy are still at country or national level. So, Pak Agus, you are right that most policy are still at the country or national level, So translation to become actionable policy at local or provincial levels are still lacking. So you are right. So I think in this paper also mentioned that how to interconnect between gap. So there is a presidential act in 2020 to facilitate the collaboration efforts between all stakeholders. So President has launched what they call it presidential regulation in year 2020 on the Indonesian Grand Plan for Disaster Management for 2022 to 2044. And this Grand Plan serves as guideline for provincial and district level to develop their disaster management at a local level. So I think this is still ongoing. Pak Agus, this is from what I got from the paper. And the second one is the Grand Plan is also aimed to as a convergence of disaster risk reduction, sustainable development, and climate change adaptation measures. So this is from the paper that I read. Thank you very much. So maybe from others can have some additional response.
I don't think he's with us just at the moment, okay? But thank you very much for your response. I have two follow-up questions listed in my database. One goes back to stunting, and it's a specific question as to whether that there is good evidence, indeed published evidence, for cause and effect relationship between climate parameters and prominent indicators of stunting. I suggest that maybe Sophia or other panelists or indeed anyone else in the audience, if you have references to documented evidence, you could reply in writing or put a message on the chat line. The second follow-up question comes back to issues for adaptation as a solution, whether at the local or national or other level, and thinking about how to share good practice in adaptation initiatives and indeed avoid maladaptation. And we have a bit of a quandary because unlike indicators of mitigation, where the effect can be measured ultimately in terms of greenhouse gases, there isn't an equivalent single indicator to quantify a climate change adaptation response. So I'm sure we probably all agree that has to be health indicators in there somewhere. I'd be interested in perspectives from the panelists on what are the health indicators for measuring adaptation in its various ways. And Maria, does the Lancet Countdown Indicators examine this question of how to develop generic single indicators for adaptation?
Oh yeah, I just need to unmute. Yeah, we follow some indicators. We have, as mentioned, a working group that works on adaptation, resilience, planning and health. And we have, of course, it's also complex to have good indicators for adaptation because if we want to follow over the years, it doesn't change much. It's rather slow. But also what we do work with in the Lancet Countdown is that we look at adaptation planning and assessment, and then we look into national adaptations plans for health. And we also have national assessments of climate change impacts, vulnerability and adaptation for health. And then also look into the city level climate change risk assessments and also see how cities perceive the needs for adaptation, how also they actually perceive the risks for health from climate change. And then also we have an indicator that we follow on climate information services for health. And then also adaptation, delivery, and implementation. And there we look into detection, preparedness, and response to health emergencies. We look into air conditioning, benefits and harms for that, because there it may be a maladaptation if we use energy that's fossil fuel based. And then we also look into urban green space as an adaptation strategy, because there is also some evidence on how urban green space may be something good regarding health, both physical but also mental health. And then also we look into health adaptation related to global funding and financial transactions. So we have some indicators that we follow, but as said, it is quite complex, and especially if we want to do it for as many countries as possible, because there is also a lack of data. So, but these are the types of indicators we use data for.
Thank you very much. Okay, we have about 10 minutes left before we have to wrap up our panel and general discussion. So if you have a question that you would like to ask in the audience, please put it forward fairly quickly. Let me ask another question that we have from previous discussions. That's about loss and damage. In the most recent UNFCCC meeting, SB56, the issues of loss and damage becoming controversial again, that essentially some of the wealthier countries perhaps are resisting some efforts to support low and middle income countries in their response to climate change, and there's a conflation between the loss and damage, climate change, and general development funding. Have any of you got ideas as to how we as scientists and health professionals can support progress on the loss and damage agenda as we come into COP27 and beyond? In particular, what would better evidence to document the health impacts of climate change help to convince wealthier countries that they really should do more, but by way of loss and damage reparation to developing countries? Or are there other financial instruments that should be re-examined in the context of redirecting funding to universal health access, for example, the subsidies for fossil fuels and so on? So perhaps I can leave you to think about that difficult question, and in the meantime ask, and I hope I can pronounce your name again, Daniel Murdia. So if you would like to ask a question that you wish to. Thank you. Daniel, you're muted.
Thank you, Chair. Thank you very much for giving me the opportunity to raise some concern about what's been discussed here. I'm with IP and also professor at Bogor Agriculture University. As you can see in my background here, I've been working a lot in the coastal zone, coastal community, mainly about carbon stock and climate change, cycling of carbon, etc. But I have in my team recently trying to understand the nutrition and health issue in this very poor community in general. Our preliminary result is that the stunting issue has nothing to do with climate change. We have thousands of household survey indicating that even if they are very close with the source of good nutrition or nutritious food like fish, it's not necessarily that fisher men and women feed their kids with what they catch from what they have in the nearby environment. but they sell it, and what is consumed by the family is something different. And this very specific survey is done. It's not very detailed in terms of nutrition content, but we have numbers of particular nutrition and mineral intake by kids between 5 to 12. Again, so far we did not find anything to do with the changing climate, especially in a very vulnerable area like coastal zone with sea level rise, drought, flooding, etc. So I wonder if conclusion or statement like climate change affect stunting children. I wonder if there is any parameter that shows that, especially climatic parameter, what climatic parameter would affect nutrition and malnourished children. Thank you.
Thank you very much, Daniel, for your comment clarifying some of the issues. Of course, it might, and I'm not an expert on stunting, but it might well be that different drivers of stunting operate at different levels in different regions. But your point that we need more evidence is a very good one. So, Sophia, did you want to come back on that at all, or we're running out of time? We say you may want to take that discussion further in terms of what the written evidence shows. You're muted.
Yeah, I want to invite Maria first to comment on that. Maria?
Yeah, I would like you, if you send me an email, I can share some of the reports and papers that we have so far, but you're completely right. And also, as you say, Robin, it differs, of course, and we need more research. But there is some literature reviews looking into this that supports that climate change has an effect on stunting as well. For example, at the micronutrient level. But please send me an email because it's a long story.
Okay. No, what I mean is maybe the paper you may send, and then we can share it to Prof. Murger. So
absolutely.
Yeah.
If you write to me, I'll share.
Yeah, sure.
Thank you very much. I'll drop my email address. That's will be very helpful for my team.
Yeah.
See that.
Thank you all. Yeah, thank you all. I'll leave it.
It's good. It's good point. Yeah, it's
to
good
continue.
Point. Yeah.
We are almost at the end of our discussion session, and I use the remaining couple of minutes to ask if our 4 panelists, but I think we're down to 3 at the moment, or any of the other speakers wanted to give a final remark. But before we move on to Professor Volker Temerlin's closing remarks, I think I would just remind you that our discussion today comes at a very important time for the S20 and the G20. The S20 summit will be later this month in Indonesia, and the G20 summit itself will be, I think, in November in Indonesia. So as we think further about what we've heard today and what we want to emphasize, I think anything we can do to reiterate the points that have come up today to advise the S20 body in their discussions later this month, and indeed to help the S20 convince the G20 leaders at their summit about the importance of climate change issues and health, and indeed how the work of the S20 and the G20 will feed into other global discussions, particularly COP27 in Egypt in November, and also particularly the next G20 presidency in India. And I don't know if Shbana wanted to say anything about that. But anyway, we have about 2 minutes. So please, panelists, if there are any final points that you'd like to bring forward or emphasize, now's your opportunity.
Can I say something? Just you asked about loss or brought up loss and damage, and I think it's an ethical perspective that we really need to bring forward when we talk about this. I mean, we need narratives from different parts of the world telling the stories about how people are impacted by climate change, and learn from history also. For example, when we had the tobacco epidemic, we learned from that. We got the evidence. Politicians started to act on the evidence, and when the rest of us people understood more about passive smoking, that if you even didn't smoke but got hurt, then it really took. It really got more intense in actions. And I think the ethical perspectives, when we understand that others are hurt by what we contribute to, I think also that is a perspective that is important to bring forward. So that's one thing.
Thank you.
I would just like to add to what Professor Maria said, like, of course, a lot of loss and damage is also happening in developing countries, but our research is definitely, so we lack the system to recording all the loss and damage. So I think we need further research and systems so that we have the data so that we can correlate that or attribute that which damage is happening by normal vulnerability versus climate change. So I think further research is required in this direction.
Absolutely, and also most of the research, well, a lot of the research comes from high-income countries, and we need research from low and middle-income countries.
Okay. Thank you, Shabana and Maria. Sophia, do you want to say anything before we close the session?
Yeah. Thank you. Yeah, I think one point that to strengthen resilience healthcare system, I think we have to do mapping of regions to be able to approach tailor-made. So because the effect is so different, so we have to have the mapping of each region. So the approach for this mitigation and adaptation will be specific to the area. Thank you.
Thank you. Okay, so we are out of time. Let me close the discussion by warmly thanking our panelists and thanking those who have asked questions from the audience, and indeed all of you in the audience who have listened to our discussions. And if there are any further points on which you wish to follow up, but then please, I'm sure our secretariat would be very pleased to help you interact with the speakers. So thank you all very much. I hand back to Yodi now, if I may.
Yes. Okay.
Thank you all.
Thank you, Robin. Thank you for moderating the panel so effectively. And thank you to the panelists for sharing your thoughts and insights with us on climate change and health. Now we will turn to Professor Volker Termeulen from the wrap-up. He is IEP Special Advisor, co-chair for IEP Project Climate Change and Health. Professor Volker, the floor is yours.
Dear colleagues, dear participants, as we have heard today, there are unprecedented threats to health from climate change. But there are also unprecedented opportunities to generate and use the evidence to inform and implement solutions. I welcome the S20 activities this year, led by the Indonesian presidency of G20, that are helping to develop political momentum to transformative change. In my concluding remarks, I want briefly to return to the contributions that IAP has been making in its project on climate change and health, drawing on the expertise and commitment of academies worldwide, including, of course, the Indonesian Academy of Sciences. By encouraging academies to capture diversity in evaluating evidence from their own countries and by their participation in regional activity networks such as ASA for the Asian Pacific region, we are able to identify common features and explore variability in the impacts of climate change on health and ensure a focus on the most vulnerable groups. Our objective has been and is to advise on policy options for identifying and implementing mitigation and policy solutions. The global and regional reports from the IAP project are now all published, and they represent a tremendous comprehensive resource to stimulate further discussion and catalyze action. Our headline messages are: climate change, as we discussed, is a serious threat now to human physical and mental health. Impacts are greatest on those populations who are least able to cope and who have contributed least to generate the global problems. Solutions are within reach using present knowledge. Rapid and decisive actions can reduce long-term risk and bring near-term benefits to health. And of course, impacts will cross national boundaries. There's urgent need for better monitoring and surveillance and for quantification of the benefits of action, their trade-offs and costs. Climate change intersects with other global challenges, in particular in the recent COVID-19 pandemic. Our report also described many of the priorities for transdisciplinary research worldwide in order to fill knowledge gaps. And our recommendations from the project are not directed only to others. Sorry. We also emphasize our own responsibilities in the scientific and health communities to drive transformative change. The evidence base must be used with greater urgency and ambition to integrate action between countries, sectors, and levels of governance. Data linkages, for example, between climate change and health, must be strengthened. For our past, academies can spur effort integrated at national, regional, and global levels to help address systemic inequalities and promote health equity and climate justice. I congratulate the S20 for their leadership in emphasizing the critical role of science to inform policy and raising the visibility of the issues for strengthening health system resilience for climate change. I very much hope that the outputs from our excellent workshop today will be useful in feeding into the S20 and G20 summits later this month and this autumn, and can contribute to building sustained G20 commitment to these most important issues for us all. There's much still to be done. For example, it highlights the importance of health as a priority in the wider climate change policy decisions, such as will be made in the forthcoming COP27. I'm sorry. I take this opportunity to thank our panelists for their excellent presentations and contributions to the discussion. Sir Andy Haynes, as co-chair of our IAP project, for his keynote speech, and of course for his great input into our climate change and health studies and reports. Robin Fierce, for the moderation of our meeting and his engagement in our IAP project, as well as writing the global report. The Indonesian Academy of Sciences making our website possible, and last but not least, the participants of this webinar and their contribution to this meeting. And with this, in turn, I take it over and ask Professor Sudoyo and to give his closing remarks. Thank you.
Thank you, Professor Volker Termulen, for wrapping up the webinar for us and highlighting the key critical issues. Now we will turn to Professor Herawati Sudoyo for closing remarks. She is the chair of the Medical Science Commissions of the IEP. Prof. Hera is currently on travel, so she has kindly prepared a video recording of her closing remark. May we have the video, please?
Dear colleagues and participants, climate change are occurring in every region and globally. It is unequivocal that human influence has warmed the atmosphere, ocean, and land. Climate change affects many of the social and environmental determinants of health: clean air, safe drinking water, sufficient foods, and secure shelters. It is not only has direct impacts on human health, but also threatens the capacity of health system to manage and protect population health. As health systems are the main line of defense in protecting population from impact of climate change, it is essential to ensure that health system can continue to deliver essential health function during extreme events and under climate stress. Right now, we express our appreciation to all panelists and resource persons who have shared their perspective, experiences, points of view, challenges, and current state of climate change and health. This will be very important knowledge on how to strengthen and integrate adaptation and mitigation strategy into health system to ensure the health system resilience. From this event, we expect to have a comprehensive understanding to anticipate, prevent, prepare, and manage climate-related health risks that can strengthen our health system and adaptation of the climate changes. To conclude, health system can only be strengthened through collaboration and concrete action. Thank you.
Thank you, Professor Hera, for your closing remark. Ladies and gentlemen, we conclude the S20 Climate Change and Health webinar as part of Indonesia's presidency of the G20 in 2022. Thank you again to all speakers, all panelists, audience members, and organizers, and we wish you all good health. Thank you and goodbye. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Terima kasih.